Singapore will add more than 1,000 new beds across public hospitals and healthcare facilities this year to alleviate higher patient volumes. The Health Ministry is also introducing measures to hire and retain more nurses to meet increasing manpower needs. Sherlyn Xia reports.
Full hospital wards are a common sight these days, with patients staying much longer, averaging 7 days of hospital care. To ease the mounting pressure on healthcare workers, the government is adding 280 beds across several acute care hospitals this year.
Workload is discernibly heavier than before the pandemic, even though we see relatively few COVID-19 patients who require hospitalization. Instead, we are seeing more people sick with other illnesses, and there are more seniors, more complex cases, more with comorbidity issues.
And to reserve acute hospital spaces for the most urgent cases, the Health Ministry will also roll out hundreds of new beds to other public healthcare sites. Outside of acute medical needs, capacity for transitional and rehabilitation care will also be ramped up. Across community hospitals, care facilities and nursing homes, they'll get 800 new beds by the end of the year. And if acute medical patients can get successfully transferred to these more appropriate settings of care, now that's equivalent to adding a whole regional hospital to Singapore's healthcare system. To man the expanded capacity, MOH is introducing measures to get new nurses on board.
Today, 2/3 of the available pool of nursing graduates enter the sector. The other 1/3, they join other sectors. If we are faster in encouraging our nursing graduates to join the healthcare workforce, it will help address our manpower needs significantly.
MOH is offering sign-on bonuses of $15,000 to fresh local nursing graduates who join the public healthcare clusters or publicly funded residential care groups this year. Sponsorship packages have also been enhanced to cover at least half of a student's tuition fees and include allowances during training. Nurses say this can help meet growing demand for patient care.
Patient needs are getting more and more complex. We really need a lot more nurses in the hospital as well as in the community to look after our growing elderly population.
Some nurses, they want better job and also better salary. So hopefully with this incentive that's given, they can stay longer.
Grace and Fatima are among 125 nurses receiving the Nurses Merit Award for their service. To retain nurses like them in the healthcare sector, MOH is also looking into a long-term retention scheme and working with employers to review nurses' salaries.